Thank you everybody for coming. It is being recorded. And so I am happy to introduce May and Karen, who will tell us a little bit about themselves as they start, so I don't have to read a bio. And so I think this webinar is going to be very interesting. I look forward to hearing what you all have to say. So off we go.
Awesome. Thank you so much for the warm welcome. And hello, everyone. My name is May Sandberg.
And I'm Karen Buenrostro, and we are with the National Institutes of Health All of Us Research Program.
We would like to thank our partners at the North Central Regional Center for Rural Development for creating this opportunity. Thank you so much for joining us today to talk about something really important to all of us, and that is health research.
But before we get started, we're going to take a moment to introduce ourselves. So May, would you like to kick us off?
Absolutely. So first and foremost, hello from Indianapolis. I am in the state of Indiana and have family members who are Purdue graduates. And I have called Indianapolis my home for the past 22 years. I not only work for the All of Us Research Program, but I am also a participant in the program because both as a Mexican American and a woman, I have been underrepresented in biomedical research. I am the first person in my family to ever participate in medical research. And I just recently found out that the males in my family suffer from leukemia, as well as some mental health diagnoses, such as schizophrenia. Because of this, I recognize the importance and the value of diversity, knowing more about our mental health and physical health, better healthcare and prevention for all communities. And, sharing this information with you today is very important because we all have the power to make a difference.
I definitely couldn't agree more, May. So a little bit about me. I am actually from Texas. So I'm from West Texas. So May and I are definitely miles apart, but we're both really passionate about this program. So I actually joined this initiative at the end of last year because I really wanted to contribute to something bigger than myself. So by joining the All of Us Research Program, I feel like my participation will not only help improve the health of my own family and community, but future generations to come. I also recognize the importance of diversity and the importance of better understanding the nuances within different communities when it comes to health research. And like May said, that's why sharing this information today is super important to us because we all have something to contribute. Both sides of my family actually suffer from diabetes, high blood pressure, and cholesterol. So I know that those are all things down the pipeline that are not only going to affect me, but if I choose to one day have children, then that may also affect them. So let's talk about what we're going to cover today. We're going to discuss what the All of Us Research Program is, who is involved in the program, and how you can get involved.
Absolutely. Thank you. And a side note, both Karen and I lived in Texas. I was born in Texas, but I'm a Hoosier. So now let's have a quick show of hands. Who here would like their medical providers to give solutions that are specific to you as an individual? So for example, your doctor to know you as a person. Either use the clapping emoji or type in yes in the chat.
Definitely me.
Yes, exactly. Me too. The majority of us do, right? We all want our doctors to know us, who we are, and treat us individually. And that's why we're here today.
So now we're going to set the stage by providing a little background information on health research. So health research is the process of finding out new things about improving people's healthcare. And it's important because we all want to live long and healthy lives, right?
Absolutely. And health research can only help people of all backgrounds if people of all backgrounds get involved. And this is really the foundation of the All of Us Research Program.
So what exactly is All of Us? Well, it's a large program that's led by the National Institutes of Health that's working to improve healthcare through research. Unlike research studies that focus on one specific disease or group of people, All of Us is building a diverse data set that can inform thousands of studies on a variety of health conditions.
And not only that, but we hope that it'll last for 10 years or more. It's a longitudinal effort. That means that we plan to have this go for 10 years or more to gather data from at least 1 million people who reflect the diversity of the United States in order to accelerate health research and have medical breakthroughs and help enable individualized prevention, treatment, and care for all of us.
Now we're going to talk a little bit about precision medicine and what that means. So each person is different, right? Our habits, our environments, and our biology. And the interactions of these factors greatly impacts our health. But when we visit the doctor, our treatments are usually a one-size-fits-all approach. To provide healthcare that meets everyone's needs, we need precision medicine. Precision medicine focuses on treating a person's specific healthcare needs. In order to understand everyone's healthcare needs, scientific experts need health data from as many people as possible. It acknowledges that a one-size-fits-all approach to medicine isn't the best because we know that what works to treat me may not work to treat you. Precision medicine is a radical shift in how each of us can receive the best care possible based on our unique makeup.
Absolutely. And if you're like me without their contacts or their glasses, this slide should look a little blurry to you. And don't worry, it's on purpose. It's going to help us learn about precision medicine. So raise your hand if you know someone who wears prescription glasses or contact lenses. That's Karen and I, for sure.
I wish I had 20/20 vision so that I didn't have to pay for different contact prescriptions.
Me too. I know advancements in that are, I mean, think about where we were, just 40 years ago with ocular health. But we all know someone who wears contact lenses or eyeglasses. What you may not know is that they are precision medicine. These are common examples of it. They are custom solutions to an individual needs. Not just that, for example, in our own selves, my left eye prescription is very different from my right eye's prescription. I wonder if I could ask you guys a question. So how many people in the United States do you think have visual impairment? Just take a guess. Anyone who has trouble seeing. Of all of our population, what do you guys think? And let's have you guys type it into the chat.
I'm guessing they think it's 0.
They're thinking that it's no one, but let's go ahead and tell them that it's 14 million people. 14 million people in the United States ages 12 and older have self-reported visual impairment. And we know prescription glasses are common. If you don't wear them yourself, you're likely to know someone who does. But what you may not realize is that they are precision medicine.
And here behind the glasses, you can actually see the representation of someone who would view it with 20/40 vision. However, you apply prescription glasses, AKA precision medicine, and it goes from 20/40 to 20/20. Like May said, what works for one person might not always work for another. That's why most of us have different vision prescriptions. And as you saw here, a custom solution was created for the individual's needs. And in times like this, health research feels especially important. But to get there, researchers need more data, and that's where you can help us.
Absolutely. Now let's play a sorting game, right? This will help us go a little further into what is considered a lifestyle, genetic, or environmental factor that affects our health. So here you see a collection of phrases, and we will read one at a time. I don't see a lot of participation. I know I can be a little shy sometimes, so Karen and I will play this one together. And we'll read one at a time, and we'll decide if it is lifestyle, genetics, or environmental factors. Do you want to get us started, Karen?
Sure. So let's go with I am left-handed. Is that genetics, lifestyle, or environment?
Genetics?
You are correct. Have you played this, May?
Maybe.
So you're going to put it under genetics since most people usually write with a certain hand. Some people, however, may be influenced by who teaches them how to write, which could fall under environment.
Absolutely. I know I had a classmate of mine who was left-handed, but the desks were made for right-handed people. So eventually he learned to be ambidextrous. The next one, I have experienced a natural disaster. What do you think, Karen? Lifestyle, genetics, or environment? What do you think?
Definitely environment. I lived through the winter storm here in Texas. Hopefully we don't get one of those again this year. But yes, definitely environment.
Absolutely. Since certain areas of the country are predisposed to natural disasters like earthquakes, here in the Midwest, tornadoes, and apparently in Texas, some very bad ice storms.
I live in the desert and I was like, no, thank you. Don't keep those up there.
That's right.
So the next one, and I'm not very good at this, is I eat breakfast every day. Do you think that's lifestyle, genetics, or environment?
I'm going to say lifestyle because both you and I do not do a very good job of breakfast. Does coffee count?
It's liquid breakfast. So this one falls under lifestyle because certain people choose to eat or not eat breakfast, but it could also be environment based on where you live and food security.
Absolutely. The next one, Karen thinks is nuts that I used to drink out of a hose in Texas. So what about if I drink tap water? Is that genetics, lifestyle, or environment?
For your case, I'm going to say it's lifestyle.
It was lifestyle. I was a little kid in Texas and it was very hot. So this one could fall under lifestyle or environment. But in this case, it is environment since where you live could dictate your access to clean tap water or the need for bottled water. For example, our friends and family in Flint, Michigan.
So this next one I'm sure we have all felt is I feel stressed often. Do you think it's genetics, lifestyle, or environment?
So since I played this game before, all of them, am I correct?
Yes, this one could fall under any of them. And especially now during the holidays, I'm going to go with mine would fall under lifestyle. So like I said, this one could fall under any of them, but here it's going to go under lifestyle because of how different factors of how you live shape your stress levels, like your job or, trying to go to the store and find everybody's Christmas presents this far in the game. It could also be genetics if you're genetically predisposed or environment if your environment causes stress.
Absolutely. There's a lot that we're learning in regards to genetic predisposition to stress, as well as your environment producing a lot of stress. Last but not least, for people who have beautiful, naturally curly hair, lifestyle, genetics, or environment.
I'm going to go with genetics because my sister has beautiful curly hair and I do not.
You are correct. It is genetics, since that determines your natural hair pattern or texture. But it could be curlier or more curly based on your environment and lifestyle. I think of the few times I've had the privilege to be at a beach and how my hair looks amazing when I'm there. That should be enough for us to visit again.
So we hope you all enjoyed the game and have a better understanding of the different factors that go into precision medicine and how each one truly does impact your health and makes you unique.
Absolutely. Now on to our favorite part, which is the diversity piece. This is a great professional and personal passion of mine. All of us is asking a lot of people to join. Participants are from different races, ethnicities, age groups, and regions of the country. We want to make sure that we're inclusive of everyone. They're also diverse in gender identity, sexual orientation, and health status.
Did you know that the majority of health research has been conducted with middle-aged Caucasian men as the participants? Yeah. That means the medicine from that research ends up designed specifically for that demographic. In other words, if you're not a middle-aged white man, then the medicine you're taking may not be the most effective for your body.
Correct. That would not be effective for you and me. But also us as Latinx or Hispanics, we make up 20% of the population in the United States, but we've only been represented in 1% of previous studies.
And African Americans make up more than 13%, but are represented in just 5% of past clinical trials. So May, what does all of this really mean?
Well, what it means is that a lot of people and their communities have not participated or been included or even invited. And we really need to change that. And we need everyone's information. By studying data from a diverse group of people, researchers can learn more about what makes people get sick or helps them stay healthy.
Data from all of us could someday help researchers identify what makes people more likely to develop a disease, find out how environment, lifestyle, and genes can impact health, help researchers build better tools for detecting a health condition and encouraging healthy habits. And this may help you and your family make better health decisions and help researchers find out why your community is more likely to suffer from certain health conditions.
And it's really important to break this down in a way that we hope makes sense. So diversity is important because those underserved in research have not been included enough in research. And because of this, they've been left behind. And we don't want that to continue to happen. So All of Us is really leading the way in helping influence how health research is conducted, and that diversity is super important to all communities.
And speaking of community, every community has its values. So now we're going to talk a little bit about the program's core values.
Yep. So first and foremost, participation is open to everyone. And when we say everyone, they need to be eligible. So you need to be 18 years or older. We are working on children being able to participate, but at this time, only adults who live in the United States, including racial and ethnic minorities. People with physical and developmental disabilities are welcome. Our friends in the LGBTQI+ communities, people living in rural areas, as well as low socioeconomic status communities. You can be healthy or have health issues. Everyone is welcome.
And our participants really reflect the diversity of the United States. So we want to be as inclusive as possible so we can reflect the diversity of America and give everyone that chance to have a voice in research. Diversity is definitely a cornerstone of the program.
Absolutely. And participants are partners. Both Karen and I participate, right? So they want to hear from us and we want to shape the program. We also get to learn about our own health in the process of our participation.
And we also want to be as transparent as possible. So we inform participants about how their data is used, accessed, and shared.
Absolutely. Speaking of that information, participants have access to their own information. You get to see everything that is learned about you, and it belongs to you. All of Us lets you see your own information and records.
And data is broadly accessible for research purposes. All of Us makes information about participants as a group available in a public database called the All of Us Research Hub, where anyone can explore the database or use it to make discoveries. Data from individual participants is also available, but only for researchers who apply and are approved.
Yes, it's really important to share that. And of course, the program aims to be a catalyst for positive change in research. Working together, the All of Us researchers, partners, our participants, we can contribute to health research and healthcare. And last but not least, of course, security and privacy are of our highest importance.
Safeguarding your identity and data to the best of anyone's ability, like May said, is our most important responsibility.
We absolutely take privacy and security very seriously. Let's really just think about how hard it can be to have some of our communities really trust a health research program. So we do want to make sure to share that it is a top priority in the program and that we use the latest technology to help keep everyone's information private and safe.
And not only that, but identifiable information like your name and address are stripped away from your samples and you are assigned a unique code.
Yep. And when the research does begin, researchers sign an affidavit saying that they will not try to find out who you are.
And survey and all personal information are kept safe on an encrypted server with limited access. And we hire a third-party agency to continuously test our system to keep it safe.
And also we have things called certificates of confidentiality from the government. These help us fight any legal demands to give out information that could identify you.
That's awesome.
And just like our banking systems, privacy and security can never be 100% guaranteed. You know, people get creative, but the risk can be minimized as much as possible. And we do our very best to ensure your information is safe and secure.
And it's really important to share that All of Us is voluntary. So you're free to share as much. Sorry, yeah, there was like a big old fly in my face.
Oh, no.
So it's really important to share that it is voluntary. So you're free to share as little or as much as you feel comfortable with. I actually chose to become a participant in the program because I felt like my information was safe and secure. And I really liked that I could access my data at any time, either online or through the participant portal or the mobile app.
And don't you just love that? I'm always checking online to see what new updates I have on the program. I did participate in our DNA information, so I'm looking forward to when that comes through. And, you know, I did pay for a service, and this is free. You can get your genetic information and your ancestry information for free. I'm looking forward to seeing what they might look like side by side. So I know that was a lot of information, and which is why the fly came in, because it wanted to give us a pause.
Take a break.
Does anyone have any questions thus far? that we might be able to answer. If not, we can move forward with our conclusion. I'm going to take a look at our chat and see if anyone has any questions.
I don't see.
Can you talk a little bit more about how researchers might use this information? Do you have any examples or something more? Because I'm sure we have a lot of, we sure we have a lot of researchers on the webinar, and I'm sure that's something that they might want to ask about.
That's a great question. Thank you so much for asking that. I would like to share, and I'll post it in our chat, the Researcher Hub. So what that is the public-facing aspect of the All of Us research program, where you can see what current research is being conducted using the data set. How many of those are based on something of interest. So for example, if you type in the keyword cancer or the keyword women or a keyword trans, for example, you can see all the research that's being conducted using this data set. Who's conducting it, the name of the researcher, what their anticipated findings are going to be, what the research is for. It's really wonderful. And of course, the anonymity of the participants is 100% guaranteed. But I think it's really interesting to pique the curiosity of a researcher. Thanks so much, Karen, for putting that up. So right now, as of right now, we have 926 active projects using research projects, of course, using the data set, which the last time Karen and I presented, we were at 870. So it is constantly growing, even more so this year. And I think a lot of that has to do with curiosity and also a greater focus in health, especially because of COVID-19 and the pandemic. So which parameter did you use to show right now, Karen? You typed in cancer. So as of right now, for example, we have 75 projects that are looking into that or include the word cancer in the project title. If you were to click on it like she just did, you can see what the questions are being studied, what the purpose is, what are the scientific approaches, the anticipated findings, what are the demographic categories of interest. And what I love is you can contact the research team themselves, and you can see that there. I love this about the program because I think it really inspires, as we were talking about, not only do we need participants, but we also need, a fresh pair of eyes and perspectives from researchers themselves. And there are some publications based on the research that's being conducted on our data set as well. I hope that answers the question, or at least gives you an understanding of, from a research standpoint. And since we do have researchers perhaps on the webinar, Karen and I actually partner with our research team, and we can come back and show you what the back end of that research looks like and go more in depth on the research. It's really interesting, how that works. And if anyone is interested, we are welcome to come back and dive deeper into the research aspect of it.
Mm-hmm.
Great question. No, I love it. I love it when we have questions. Well, so now you're probably wondering, well, that's great, Karen and May, that sounds good, but why are you here today? Well, what's in it for you as a person and as a potential researcher?
So by participating, you'll get a chance to learn about your own health, including personalized risk factors or exposures, which was a really big thing of why I wanted to participate. You'll also have the ability to access your own data, including increasingly rich health records and ancestry trait information, like May mentioned previously.
Absolutely. And you'll also have an opportunity to ensure that your community, we all belong to different communities, right? That your community is included in health research. And this will help address those health disparities.
You'll also have an opportunity to make an impact on current COVID-19 research. If you're looking for additional ways to support the work, there are two scientific activities that All of Us is involved in. One is antibody testing and electronic health records collections, and All of Us participants may be able to support both efforts.
And a little caveat in there too is that during the pandemic, we also had the COPE survey. And this really focused on trying to capture how everyone was coping with the pandemic. Not only does the research aim to capture physical health, we're also wanting to make sure that we're capturing mental health as well. And we look forward to the findings of that. It did run for a year during the pandemic, and right now we're aggregating that data. But it is important to share that not only are we focused on physical, but mental health is a great component and one that we really acknowledge in the All of Us research program. And again, if this pandemic has taught us anything, it has been the frailty of our health, right? And even now, as we're slowly emerging and possibly not emerging, it's never felt more urgent to participate in health research than it does now. And I guess that's what I love about the All of Us research program, is that it really is focused on not just what we might learn in the future, but also what's going on today. All right, well, let's take a look at some of our partners in the program. These are people who believe in the All of Us research program and help us in various capacities. We currently have over 100 organizations, and we just added you guys as our partners. And here are just some that you might recognize, right? Your neighborhood Walgreens or WebMD, where people go and find terrible diagnoses sometimes. But they are our partners, yes.
And partners like these are the foundation of how the All of Us research program aims to serve diverse communities.
And now that you've heard us talk about the program, let's show you a short video about what All of Us means to others.
Well, I think that what's unique and important about the All of Us research program is that, there are treatments and medications that don't work for everyone. And this program is really trying to find out why.
This research process will only become better if we have more diverse communities involved. Any medical breakthrough that we'll see has to have your input. It has to have your DNA. It has to have part of you in it, because you are part of this universe. And we need to be represented. We need to be part of this medical breakthrough.
Different people have different diseases, different problems. What caused this might not be what causes somebody else's diabetes. Yes, I think it's important for all people to be represented in medical research, all these different age groups, ethnic groups, regions of the country. They get together, tell their medical histories so that we can all get the full benefit of what medical research has to offer us.
I think the All of Us research program is an amazing program. I think about it as an ethical issue and a social justice issue to make sure that our research is inclusive and we have as diverse patient populations as possible.
So now you're probably wondering, how can I get started? Well, there are two ways that you can join. One is by visiting our website at joinallofus.org/connect. There you can learn more about the program or choose to sign up if you're ready today. Or you can download the All of Us Research app in the Google Play or Apple App Store. Please be sure to download the one named All of Us Research with the all-white background created by Care Evolution. And this short little video shows you an overview of what you'll see when you download the app. If you're curious like me, I first went to the website because I wanted to know, why does this program exist? What type of information are you going to be asking from me? What are you going to do with my information? So if you're curious like me and want to learn more, I would definitely recommend that you go to the website first, because we also have frequently asked questions page there. And the website is available in English and Spanish as well.
Absolutely. I'm so glad that you said that, because I too was curious, and you can join from that page as well. But I think it's a good starting point to learn a little more. We know our presentations can be limited. It's such a big program. So if you're curious about other things, please follow Karen's advice and go there. Let's say that you've downloaded the app or you're on the page and you're ready to join. Well, then you'll create an account and you'll be asked to give your consent. This is why it's important to go to the website first. Before you start giving consent, you can learn a little bit more about yourself. And this includes reviewing a series of videos. I like these because sometimes we move through things very quickly and we don't read the fine print. The fine print on this, of course, is not fine. It's very transparent, and it's produced in some videos that you can watch. Once you feel comfortable that you know what to expect from the program and you're ready to move forward, you can electronically sign the consent form. And you can do this from your computer, your tablet, smartphone, or any of our partner sites. You may also elect to share your electronic health records, which is a digital version of your medical chart. You don't have to, but you're welcome to do that as well. And you can also participate in our DNA results. Again, you don't have to, but it is an option for you. If you'd like to also provide us some information, you'll answer some health surveys in combination with other health information. And these answers that you provide will help researchers identify patterns about how your lifestyle and your background affect your health.
And after these initial steps, you may be asked to share your physical measurements and provide your biological samples so that the program can help researchers better understand how different factors, including our genetics, make our participants unique. Like I mentioned earlier, every part of the program is voluntary, so you're free to share your DNA samples if you would like. If you don't want to, you can still participate in the program by participating in health surveys as well. And if you do choose to share your samples, they will actually be sent and stored at the All of Us Biobank at the Mayo Clinic. And the biobank securely stores the participant samples that the program has collected this far until they're used by researchers. Depending on your location, you may have different options to continue on to this next step of the enrollment process. So for example, you may be able to request an at-home saliva collection kit to be mailed directly to you. And that's what I did because I live out here in Texas, basically in the boonies. And there wasn't a site available for me to actually go and drop off my bio samples. So I did the saliva collection kit, and it gives you instructions on how to provide a sample and how to return the prepaid package through USPS.
Absolutely. And parts of Indiana do provide the saliva collection kit, but we also have Quest Diagnostics as our laboratory partners. So if you live near a Quest Diagnostic participating center, you might participate and qualify for Bring Your Own Kit. And that is also done through the participant portal. There you can schedule an appointment at a local Quest site, and they will mail you a kit. Now, really important, do not open it, just bring it with you, but don't worry, they will send you specific instructions on how to get that. And, you know, we really would like for you to be a part of the All of Us research program starting today until the end of its course. And we hope that it's within 10 years or more.
And in the future, you may be asked to take online surveys and share data from personal devices. I actually shared my Fitbit electronic device to keep me accountable, but it didn't work this year. So here's hoping to next year. And we'll ask you to update your health information and lifestyle information from time to time. And truly our hope is that you'll be part of us for many years. So next, I want to invite everyone to get out their phones and open up your camera or QR code scanner. And the QR code you see here is actually going to take you straight to our website, joinallofus.org/connect, or you can go to the link that we provided in the chat.
Absolutely. And you know, All of Us is delivering one of the largest, richest biomedical data sets that is broadly available and secure. Together, we can make a difference in speeding up research and improving the health of our communities. Now we'd like to open things up for some questions, and we'll start with any that might be in the chat. And if you know, let's go through there, or feel free to unmute yourselves and let us know if you have any questions. All right. Well, hopefully you're scanning our QR code or going to the website, trying to find out a little bit more about the All of Us research program. Once again, it's been a true honor to be able to come and share this information with you.
So I don't see any questions in the chat, but like I said, we definitely recommend that you go to the website and do some research of your own. I know we've presented a lot of information here today, and I know personally, I talk a million miles a minute, so I know it takes kind of a second to digest all of this information. So please feel free to go to the website. And like I said, we have our frequently asked questions there. You can learn more about the program and its mission there as well. So if there are no more questions, we would like to thank you for being such a great audience and for allowing us time to share about the All of Us research program with you. So thank you again for taking the time to learn about us and its efforts to improve healthcare for all.
You're most welcome. And up next is a slide for our next webinar, I believe, on the impacts of flooding and business activity and employment. Maria, if you would like to add more to that.
Yeah, so the next webinar for the NCRCRD will be January 20th, and that should be the impacts of flooding on business activity and employment. That will make more sense.
I was wondering, but I said, who am I to judge? I don't know.
Just a little bit of a typo. So that will be presented by Mark Skidmore, and should be a very interesting webinar. Thanks all for coming to this webinar. And you should really look at their research portal website. It's really interesting that they have 11,000 people that are sharing their Fitbit information. I find that very fascinating. You always wonder where some of that stuff goes.
Some of us don't have that much activity. We're still contributing.
That's right. And, you know, it's just been so interesting for us because, you know, one of our biggest barriers is trust and re-earning the trust of some communities. You know, we've made mistakes along the way, you know, the NIH, not personally, but research itself. And so we know it can be hard to, you know, simply blindly want to give information. So I really appreciate what the All of Us research program is trying to do to ensure that everyone has access to their own information. They can see what it's being used for and that they can benefit themselves. It's so empowering to know something about yourself that you can take to your doctor or share with your family. So we hope you found the information interesting and that you at least go to our website to learn a little bit more.
Well, it looks like it's a question from Shelly. Can you also share your Amazon Hello Fitness information or other fitness devices, or is this limited to Fitbit?
No, it's to everyone. You're correct. I have an iWatch, which I'm not wearing right now. That's terrible. I totally forgot this morning. But yes, you can, many personal devices. We know there's so many out there. Now, another thing that we do as a program is that we know that not everyone can afford a personal device. So there are certain parts of the country, depending on where you live, you can request one to be mailed to you, which is kind of great, right? Where you can learn a little bit more about yourself and what you're doing throughout the day. Great question, Shelly.
Great. Well, it looks like that will be the last question. So again, thank you so much, May and Karen, for telling us all this about all of us and what the NIH and you all are trying to do and trying to get more people to sign up, and how we in Extension can maybe think about communities that maybe need to be represented in research that might be interested in learning more.
Absolutely.
So
and don't forget, we'll be in Indianapolis on April 25th through May 1st. And we will send that information to you guys to share with others. If you would like to come in person, sign up, or actually learn more about the program.
Great, thank you.
You're welcome. Have a great day. Happy holidays.